Welcome to Better Than Ever Live, wherever you're watching or wherever you're listening. I hope you're making today your masterpiece. In this video, we're going to talk about something you might not have heard about, and that's a medication called Pentosan polysulfate. We're going to talk about what this medication is, how it might be helpful for you if you're dealing with arthritis, whether it's your knee or your hip or your shoulder or some other joint in your body. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Now, please understand I am not giving you medical advice. This is meant for general information and educational purposes only. Now, before we get to the discussion of osteoarthritis and Pentosan polysulfate, I do want to go over, sort of like we used to do, I want to go back over some studies, some new health studies that have just come out, just a few that I think are worth talking about, so we're going to do that. And always remember, I'd love for you to comment. So I always say, leave your name, because I obviously want to know who you are and where you are, along with your comment and question. And if it's on the 3 studies we're going to talk about here at the beginning, we'll kind of do those as we go. If you have comments about arthritis or hip and knee arthritis, questions you might have, or specifically about Pentosan polysulfate, I will get to those at the end. All right, so the first study I want to talk about is a study that just came out in a journal called Nature Communications. Scientists at the University of Edinburgh in Scotland did this really interesting study where they took the genetic data of 600,000 people and correlated it with the lifestyle habits of those 600,000 people's parents. And the theory is basically people's genetic makeup to a certain extent influences their lifestyle choices, meaning there are genes that make you more likely to drink alcohol. There are genes that make you more likely to be addicted to alcohol, so that kind of thing. And they were looking to see what lifestyle habits were most associated with longevity or shortening life, in either direction. Now, you've heard me say on this show before, longevity is not necessarily the factor or the outcome, the metric that I'm looking to measure. I would love to be 100 years old if my health span was good over all that period of time, so that I feel great, that I'm active and able to go up and down the stairs without difficulty, or play with grandkids and not get out of breath going up and down the stairs. There's one thing living to old age, is quite another if you're sick or disabled that a large period of that time. So I'm more concerned about health span. But having said that, back to longevity in this new study in Nature Communications. They found two interesting things when looking at lifestyle habits. One is probably not going to surprise you at all. If you smoke a pack of cigarettes a day, you shorten your expected lifespan by 7 years. Makes sense. Lung cancer, all that, we know all about smoking. Still stunning that so many people smoke, but that one probably isn't that surprising. But there was one lifestyle habit or act you can take that adds 2 months to your life, and it's in an incremental fashion. The more you do this, you get 2 more months going forward and forward and forward. And that was basically this. You gained an extra 2 years of life for every 1 to 2 pounds that you lost. Essentially, if you lose a kilogram of body weight, you gain 2 years in life. Again, so in a kilogram is 2.2 pounds. So if you can lose 2 pounds, let's say, you add 2 months, you lose 4 pounds. And it basically looked at body weight. And what's hard to know, it seems less likely that it's the weight per se, and much more likely that it's related to body fat. And we've talked on this show before about the danger of visceral fat. That's the fat around the organs inside your abdomen, and just belly fat in general in terms of cardiovascular risk and everything else. And also not just body fat, but also the presence of diabetes, and type 2 diabetes being much more likely in people with obesity. And so those may have played a role. But again, if you can manage to lose body weight over a period of time. And I agree, this is one where the Mayo Clinic says rather than trying to lose a ton of weight all at once, and a lot of times it comes right back up, what you really want to shoot for is trying to lose a half a pound to a pound a week. And that's reasonable to do if you basically increase the amount of calories you burn, decrease the amount of calories you consume, so that basically you burn on average about 500 to 1,000 more calories per day than you used to. That's a very achievable goal. So it requires being more physically active and exercising, but also cutting some of those calories down. But again, losing that body weight, very beneficial. Another study came out just recently, and it was more of a review study looking at coffee. Now, I did a Better Than Ever live show recently where I looked at all the health benefits of coffee. So if you missed that, definitely go back and check that live stream. We talked about cardiovascular disease, we talked about some cancers and a number of different things. But this was a review of various studies specifically looking at coffee for weight loss. And there seems to be something to it for 4 reasons. One, coffee speeds up your metabolism. Now that shouldn't be any kind of surprise because caffeine is a stimulant, and so anything that stimulates you increases your metabolism both at rest and with activity, meaning you burn more calories with exercise and just being up and around, and you burn more calories just sitting there doing nothing. It's certainly good from a just burning more calories. And again, when we talked about that with lifespan and losing weight, the more calories you burn, the easier it is to lose weight. That's the first thing. Another one is that it seems to be an appetite suppressant. Now, this one's a little tricky. There was a study that they talked about in this study that talked about if you drink a cup of coffee between 30 minutes before a meal and 4 hours before a meal. So, if it's before lunch, say you eat lunch at noon, we're talking about having a cup of coffee between 8 and 11:30. But having a cup of coffee led people to eat less food. Now, what isn't clear about that when I read that is that the coffee or is that just the fluid? Because I've seen a very similar statistic about drinking a glass of water before a meal that makes people eat less. So that's a little unclear, but it's something to think about, especially if it's before a breakfast or before a lunch. I'm not real big on coffee later in the day. Another one, coffee reduces body fat. And there's 2 ways to look at this. And it's related to just sedentary, it reduces body fat, and it seems to burn fat with exercise. As far as the burning body fat, what coffee seems to do, and there were 2 studies. One, they had people drink 3 cups of coffee a day for 4 weeks, and they had lower body fat at the end of the 4 weeks. Another study, 4 cups of coffee a day for 24 weeks, they lost 4% of their body fat. So really, really interesting. Now, they couldn't exactly tell what it was about the coffee drinking that did that. That's more coffee than I particularly recommend drinking. I like to keep it to 2 cups a day or less, and I feel like that's probably best for most people, but that is certainly a potentially good reason or a good way to lose weight, is it's burning your body fat. And then back to that thing about coffee and body fat with exercise. And this gets back to when I was in college at Wake Forest, which has a big exercise and sports science department. I remember one of the classes I took, you have to take exercise and sports science classes. I took one there, and I remember the grad assistant was talking about how they've been testing caffeine before exercise because, and this multiple studies have shown this, that if you drink a small cup of coffee or have like half a caffeine pill before you go out for a run or some kind of endurance exercise, your body shifts into a fat burning mode faster. Normally when you go out for, let's just say, an hour run, 2-hour run, if you can go that long, your body gets its energy initially from what's called glycogen. It's built up, essentially carbohydrate stores, mostly in our liver, but sometimes in our muscle. But eventually you run out of that around 30 to 45 minutes for most people. Then you start shifting to burning fat. What caffeine seems to do is that it shifts that much earlier. So you start burning fat a little bit quicker. I will tell you, I know a lot of endurance athletes that have been doing that for years and years and years. That is not a new phenomenon, but it's something to think about. Now, before I just real quickly summarizing the coffee thing, here's what I would say if you're going to say, all right, I'm going to try coffee as a weight loss strategy. One, I don't think that alone is going to make a huge difference. That's my first thing. But another one would be try to stick to black coffee. Black coffee only has about 5 calories, and again, it gets back to it can provide some sort of filling sensation, so that could be good. Avoid, though, putting cream and sugar or even half and half in it if it's all possible. And whatever you do, please avoid the fancy coffee drinks, the mocha frappa, double latte, pumpkin spice, Achino type things, what I like to call coffee flavored sugar bombs. Those are not only going to keep you from losing weight, you will very quickly put weight on with those. They're huge numbers of calories, fats, just for so many reasons. That is not the way to get your coffee. And if I couldn't depress you any worse, the third one is going to hit home with a lot of people. Study that just came out about a month ago. I actually talked about this on a TV segment I did 2 or 3 weeks ago. Study in the journal PLOS Medicine, one of the more reputable journals in Europe for medical studies. It was a study out of Germany that looked at a glass of wine a night and basically debunked the idea that wine is good for your health. And I think this is interesting. I've told this to people that I know and that I work with, that I always pay attention on the health questionnaires. When I see a patient for the first time as an orthopedic surgeon, and especially if I get people in their 60s and 70s, it's so common to see that people have a glass of wine every night. And a couple times, more than a couple times, I would just ask, just out of curiosity, what's up with the drinking a glass of wine every night? What is it about that? And it was inevitably they've heard it's good for their health. And where that comes from, and this new study out of Germany talks about this, that was based on, there was one main one, but there were a few of them, flawed studies that showed that people who abstain from alcohol die earlier. And what they found when they went back and looked at the data, the actual data, is that the abstainers were almost all people that were former alcohol addicts, and that's why they were abstaining now, and that the damage was probably done from the alcohol addiction, but they were also they didn't take into account things like substance abuse, smoking, poor diets, anything like that. When they controlled for all that, it was no different at all. Alcohol, I think, is really, to be fair, and I've heard other people talk about this, this shouldn't be surprising, because alcohol and wine, as one of those, is like a number of other behaviors that the more you do it, the worse effect it's going to have on your health and your lifespan, your mortality. Things like smoking, things like not exercising, things like being sedentary and sitting all the time, things like eating an awful diet all the time. all of those, the more, illegal drugs, the more of that you do for a longer period of time, probably the worse it's going to be for your health. Now, I know you're going to tell me, somebody's going to tell me that wine has resveratrol and that's supposed to be good for you. Now, I've never looked into this, but I remember Dave Asprey of the Bulletproof Coffee and that whole company. I remember him saying on a podcast or somewhere else that most of those benefits about wine and resveratrol are promoted by the red wine industry, that's highly overblown and mostly marketable. So I sort of looked it up a little bit. I don't know if they were big on promoting it or who was behind that. It makes sense. I don't know if that's true. But resveratrol has health benefits. I don't think anybody's going to argue that. But typically the doses needed to have benefits are somewhere between 250 and 500 milligrams a day. How much resveratrol is in a glass of red wine? Less than 1 milligram. So unless you're going to drink 250 to 500 glasses of wine a night, I don't know that, and I actually know people that would probably try to do that. I don't know that wine is as good for you as people say. I don't drink much at all, but I'm not opposed to red wine. I actually like the taste of it. And I think it's fine if you want to do it every now and then. Just don't hang it on the crutch of I'm improving my health. Know that it's not improving your health. So try to cut back as much as possible. So if you have any comments on that, certainly let me know. Now I want to get in at least a little bit. I want to talk about osteoarthritis. I want to talk about Pentosan polysulfate, because this is one of these that I feel like red pill, blue pill moments. Let's talk about it. Osteoarthritis is one of the most common afflictions that adults in this country suffer. Over 32.5 million adults, according to the CDC. If you broaden it to other forms of arthritis, like rheumatoid arthritis, almost a quarter of adults in this country have been told by a doctor they have arthritis. And it makes sense then that joint replacement surgeries are becoming more common. In 2017, orthopedic surgeons did about 1 million joint replacement surgeries that year, and that's all joints. But by 2030, it's expected just with knee replacements, there's going to be 3.5 million performed every year. But you have to remember that surgery, either total hip arthroplasty, total knee arthroplasty, joint replacements, they're not healing the damaged bone and cartilage. They're replacing the damage with metal and plastic. And the reason we've performed these surgeries for so many decades now, and joint replacement surgery, the specialists say this is the only option, it's based on the conventional theory for osteoarthritis and what that disease is. But it's just that. Osteoarthritis is a disease. The majority of doctors and orthopedic surgeons, though, believe osteoarthritis, and they tell patients that it's a wear and tear process that occurs after a major injury like a torn ACL, or over a long period of time, and somebody that places a lot of demands on their hips or knees. Runners, people who do manual labor jobs, that type of thing. That wear and tear process takes a toll on the articular cartilage and the bone under it. So the analogy doctors use so often is this tread on a tire. The tread is the articular cartilage lining on the ends of the bone. When that articular cartilage, the tire tread, gets thin, or there's even spots where there's exposed bone, the thinking goes you have to replace it with metal and plastic. Now, before it gets to the point of hip or knee replacements, there are things that we try to do to make you feel better. The mainstay for decades now has been cortisone shots into your knee. These cortisone shots don't fix the underlying problem, the worn out bone and cartilage, but they do relieve pain most of the time. But when that pain relief from one shot wears off, a few months later, you get another one. Pretty soon, you're getting less and less relief from each pain shot. You finally give up and undergo a knee replacement. The problem with cortisone shots, in addition to not actually treating the damage in the knee and helping it heal, is that there's a lot of scientific evidence now that cortisone does more damage to the knee, especially the more of them you get. It speeds the breakdown of the articular cartilage and leads to a faster progression of the arthritis. Other injections that orthopedic surgeons sometimes use include things like viscosupplementation, Synvisc, Hyalgan, Superarts, and others that do have some benefits, at least shown in some studies, but they aren't significantly better. And for some people, they don't help much at all. Some surgeons will offer to scope your knee, perform what's called a diagnostic arthroscopy and debridement, a cleanup surgery. They trim out torn part of a degenerative meniscus tear, smooth out the damage. Several studies in the last decade have shown these surgeries at best have limited benefit in the first few months after the surgery, but it's not helpful long term, and it might actually be harmful. And again, all of these treatments for osteoarthritis lead us to joint replacement. But now, there is a treatment that's being proposed, and it's been around a little while, suggested to be very, very helpful for osteoarthritis, and it's called Pentosan polysulfate. So what is Pentosan polysulfate? Well, this is an FDA-approved medication. It's used by urologists to treat symptoms of pain and discomfort from interstitial cystitis or bladder inflammation. It's been used for decades for that purpose. It's sold as an oral medication, a pill that you take by mouth under the brand name Elmeron. But Pentosan actually has been used for arthritis in the veterinary world for years and by Australian physicians for the last 5 or 6 years. It's only recently received attention for osteoarthritis here in the US. Now, there are clinics that use Pentosan as an off-label treatment for osteoarthritis, and it's used where patients inject it under the skin like diabetics do with insulin. And here are just some of the proposed mechanisms of action of why Pentosan might be effective for osteoarthritis. It's thought to improve blood flow to the subchondral bone, the bone under that damaged articular cartilage. It's thought to improve the synthesis of the cartilage matrix that holds the cartilage together. It's thought to have less or no cartilage breakdown by inflammatory cytokines, and it maintains the proteoglycan content within the articular cartilage. Basically, the cartilage is healthier. So if we're going to talk about whether this might be useful, we got to look at the studies. So let's start with the animal studies to see how well this might work. Way back in 1999, there was a review looking at osteoarthritis in rats, rabbits, dogs, a number of different animals, and they showed that Pentosan reduces joint swelling, reduces the inflammatory markers in joint fluid, the cartilage had better integrity. After all of that, just 1999, the researchers believed Pentosan should be reclassified as a structure-modifying osteoarthritis drug. Move forward to 2012, researchers created, this sounds awful, but they created arthritis in 18 horses. 9 of the horses got Pentosan, 9 were controls. The horses that received Pentosan polysulfate had less articular cartilage breakdown. 2019 study of rats with osteoarthritis, they didn't just look at symptoms, they looked at biomarkers and inflammatory mediators that we see in arthritis. Interleukin-1 beta, tumor necrosis factor alpha, cartilage oligomatrix protein, tartrate-resistant acid phosphatase, a number of others. And not only did Pentosan lead to an improvement in symptoms of arthritis, but it downregulated the expression of those degradative enzymes and inflammatory cytokines, which might explain some of its benefits. But you don't care about animals. Let's talk about humans. Again, we're going to go way back, 2005. Scientists did a randomized, double-blinded, placebo-controlled study at a medical center in Perth, Australia. Australia has been way ahead of this. 114 patients, 18 and older, with osteoarthritis in their knee, randomly assigned either getting Pentosan polysulfate as a weekly injection into the muscle for 4 weeks or a placebo injection. They were the controls. They found significant differences in duration of joint stiffness, pain at rest, and just overall global assessment, basically how well the patients were doing. And those benefits lasted for 5 months after the 4 weeks of injections. The Pentosan patients had less pain with walking, better all function, better all ability to do activities of daily living. 2010, a study did 20 patients receiving weekly subcutaneous injections of Pentosan for 6 weeks. All of them reduced joint swelling, improved knee flexion, less pain with walking, less pain going up and down stairs, and that lasted for a year. One case study, though, is worth talking about because it shows why it may actually help in humans. One 70-year-old got it. This is a 2017 study. 70-year-old with osteoarthritis had this medication. It was injected into her muscle twice a week for 3 weeks. Her pain dropped from an 8 out of 10 to a 0 out of 10. But more interesting, an MRI was taken before and after the treatment, and the bone marrow edema in the femur and the tibia of her knee that was there before starting the Pentosan was completely resolved after that short treatment. And finally, a 2019 study in PLUS-ONE, researchers found that Pentosan appears to suppress what's called nerve growth factor in the subchondral bone, probably explaining why these patients get less pain while they're dealing with osteoarthritis. And then anecdotally, I read an article where some Australian doctors were surveyed, and they say that pro athletes in Australia use it, and they've had much lower pain levels, but yet being able to maintain a high level of activity. Now, earlier I said that there are doctors here in the United States that prescribe Pentosan for patients with osteoarthritis, but they do it prescribing it as an off-label treatment. It's not currently FDA approved for osteoarthritis, but a clinical trial of Pentosan polysulfate just started a few weeks ago with the NIH, which should be a major step to having it approved by the FDA. It's researchers at Northwestern in Chicago and those Australian researchers are doing a triple-blinded, placebo-controlled trial with almost 1,000 patients, either one group getting injections twice a week sub-Q for 6 weeks, the others getting a control like a placebo injection. They're going to follow those people for 18 months, and we're really going to know if Pentosan polysulfate has a significant benefit for osteoarthritis. So let's say you decide, all right, I want to talk to my doctor and hear about it. Are there side effects? Well, Pentosan is a blood thinner. So if you're taking a blood thinner for a heart condition like Coumadin or some medical problem, probably don't want to take it. You probably also don't want to take a lot of Advil and Aleve, anti-inflammatory medications for that same reason, and you probably don't want to take it when you're undergoing surgery. Now, as the oral pill, the Elmeron that the bladder inflammation patients take, diarrhea, hair loss, nausea, headache, stomach upset, abdominal pain, those have all been reported. There's also reports that if you use Elmeron for a long period of time, years and years, there's an increased risk of an eye condition called pigmentary maculopathy. Those have not been reported with the sub-Q form of Pentosan polysulfate, the injections. Again, there aren't that many clinics here in the US where physicians and surgeons are using it for osteoarthritis, but generally when they do, it's given as a subcutaneous injection right under your skin, usually in your abdomen, twice a week for 6 weeks, but again, you can do it longer. And again, please understand, I'm not giving you medical advice. This is meant for general information and educational purposes only. So what does all this mean? From everything I read, and I spent about 4 to 5 hours about a week ago looking all this up, all this research, I believe that there is promise with Pentosan polysulfate. It does appear to improve or resolve the subchondral bone lesions, the layer of bone just below the cartilage, but we need a lot more research, especially that phase 3 trial, the randomized placebo-controlled blinded study that's being done at Northwestern. We need to know if this is truly effective for osteoarthritis. But if you're battling hip arthritis or knee arthritis or arthritis of some other joint in your body, you could at least talk to your doctor about it. So I don't know. That's kind of where we stand. I don't know if you have any comments. I don't see anybody having any comments, but I think this is one we're going to hear a lot more about in the coming weeks. All right, I'm going to wrap up here. If you'd like to read the studies that I mentioned in this video, I've put those in the description below this. If you like videos like this, if you like live streams about topics like this, information about health and wellness, healing, recovering from orthopedic injuries so you can feel and perform your best regardless of age, injury, or medical history, subscribe to this channel, click the bell to be notified when I put out a new video or when I'm on live for a live stream. If you have a bone, tendon, ligament, cartilage, muscle, arthritis type problem or injury, and you want to see somebody who truly knows about bone and joint injuries, whether you're an athlete or just an active person, I'd love to help. I'm a double board certified orthopedic surgeon and sports medicine specialist. I'd love to talk to you about all your options, not just surgery, cortisone shots, physical therapy, things like that. Go to my website, drdavidgeier.com, go to the contact page, and you can find out how to make an appointment. That information is in the description below this video. Again, my name's Dr. David Geier. Thank you so much for watching, and I look forward to helping you feel and perform better than ever. And one more thing real quickly, Thursday, if you want to join us 12 p.m. Eastern time, I'm going to be talking about hyperbaric oxygen and muscle injuries. So that, hyperbaric oxygen is a very cutting edge sort of treatment. The pro athletes have been using it for a while. We just got it in my office. I'm really excited about that. All sorts of things that may be potentially beneficial for, and we'll talk about that on Thursday. Friday, I will be here for Ask Dr. Geier Live. So if you have bone or joint injury, you have a friend or family member with a bone or joint injury, I can't give you medical advice, but come Friday at noon, post those questions in the chat, and I will do my best to explain what that injury is, maybe some possible treatments that then you could talk to your doctor about it. So definitely join me Friday for Ask Dr. Geier Live. Next week, one of the topics we're going to talk about is the ketogenic diet and what its role is in sports and exercise and how it affects athletic potential. So definitely pay attention for that as well. Remember, if you aren't going to be able to make the show weekly, or I guess bi-weekly on at noon Eastern, subscribe to the podcast, Better Than Ever Live, wherever you get your podcasts. Thank you so much for joining us. Very, very excited to be here, and I look forward to seeing you Thursday, 12 p.m. Eastern time. Take care.